Hi everyone, my name's Tani Hall and I'm a psychology student at the University of New England. Today I'm going to do a presentation on behaviour modification. In particular, I'll be discussing how to apply behaviour modification principles for habit reversal, and I'll be focusing on motor tics as the habit behaviour. Motor tics are defined as repetitive jerking movements of a particular muscle group in the body, but they generally involve the muscles in the face and the neck. You may know of somebody or have a motor tic yourself. I've known several people over the years with a motor tic, and one of the more common motor tics would be rapid eye blinking. Also, my brother, he would, when we were growing up, he would flex or twitch the muscles around his nose and his upper lip, kind of like, and he would do this while watching TV, when he was nervous, while he was in class, and it would people would comment on it and he'd deny it, and he didn't seem to have any control over it, or he wasn't aware that he was doing it. And so that was his motor tic. Another one was, I had a friend who used to flick the hair from out of his eyes, and he would do it non-stop all day. The only problem being that he didn't have any hair. He'd actually shaved his head probably several years before and just never stopped flicking this imaginary hair from across his face. So there's some examples of motor tics. Children often develop motor tics but grow out of them, and this was the case for my brother. He grew out of his nose twitching. However, motor tics become a real problem when they are long-standing and they're extreme in frequency and intensity. When it becomes very obvious, not only to the person exhibiting the behaviour but also to onlookers, this is when people tend to seek treatment. Habit reversal procedures are used in the treatment program for eliminating motor tics. The procedure is usually implemented in a therapy session between the therapist and the person exhibiting the habit behaviour. And habit reversal has four main components. There's awareness training, competing response training, social support, and motivation procedures. So let's start with awareness training. Here the client is taught to describe the behaviours that are involved in the habit, and to identify when the habit occurs or when it's about to occur. Awareness training is it's a critical component because it's very important for the client to be able to discriminate each instance of the tic. And if we use rapid eye blinking as our habit behaviour, then the client needs to be able to describe that behaviour. So that could be any eye blink that occurs less than 3 seconds after the previous blink. So there it is. We've identified the unwanted behaviour and can now distinguish it from regular blinking. Now the client must identify when the habit occurs or when it's about to occur. Are there any particular times that the tic occurs? For example, when you're nervous, when you're in a social situation, when you're speaking in front of an audience. And is the onset of the tic, is it predictable? Do you know when? Do you know the situations that it occurs, and can you feel it about to occur, or is it totally unexpected? So awareness training is making sure that the client can define or distinguish the habit behaviour from regular behaviour, and know when the behaviour occurs or when it's about to occur. Once the client has completed the awareness training component, the therapist then introduces them to competing response training. Now, this involves the client learning to engage in an alternative behaviour that is incompatible with the habit behaviour. That is, when the person exhibits a habit behaviour or feels the onset of the tic, they are to immediately engage in the alternative behaviour. The competing response or alternative behaviour involves tensing the muscles involved in the tic such that the body part involved is held motionless. For example, to replace rapid eye blinking, the client would learn to open their eyes wide and blink deliberately every 5 seconds, while shifting gaze about every 10 seconds. So they would learn this behaviour, they would practice it, and use this behaviour when they have an onset of their tic, and replace the habit behaviour with the competing response. So then the therapist then instructs the client to practice the competing response during the session after each occurrence of the habit. Next, the therapist asks the client to imagine situations outside the therapy session where he or she will use the competing response in order to inhibit the habit. So the client needs to imagine those times and situations when the habit behaviour generally occurs and imagine engaging in the competing response. Finally, the therapist instructs the client to use the competing response outside the session whenever the habit is about to occur or is occurring. The third component of habit reversal is social support. The support of friends and family is important. They are encouraged to prompt the client to engage in the competing response whenever the habit behaviour occurs, and they're also asked to praise the client for not exhibiting the habit behaviour and for each time they successfully use the competing response. The final component in habit reversal is motivation strategy, where the therapist reviews all the situations in which the habit occurs with the client and brings attention to how the habit may have caused inconvenience and embarrassment. This motivation strategy is used to increase the likelihood that the client will use the competing response outside the treatment session. So just to recap, habit reversal is a behaviour modification method used to decrease the frequency of undesirable habit behaviours, like a tic, like a motor tic. There are 4 components to the habit reversal: awareness training, to teach the client to define the habit behaviour and identify when the habit behaviour is going to occur. The competing response training, where the client learns to engage in incompatible alternative behaviour each time the habit behaviour presents itself. And to increase the likelihood that the client will adhere to the habit reversal techniques, the therapist instructs family and friends to encourage the competing response behaviour. And finally, the therapist reviews the habit behaviour with the client and draws attention to the negatives of the behaviour. So thank you for watching, and I hope I've enlightened you on habit reversal techniques in behaviour modification. Thank you.